Coming to you from the American College of Emergency Physicians, this is ReachMD. I'm Dr. Matt Birnholz. I'm joined by Dr. Paul Kivela. He's Vice President of ACEP, and prior to that, he was the Secretary-Treasurer of ACEP, and I believe just about every other position possible that one could attain and be elected for at ACEP. Welcome to you, Dr. Kivela.
Well, thank you very much. That's very kind, but I'm just here to serve.
And I'm here to serve you. My first question to you is, in the role of Vice President, a lot of people don't know what goes into that, and as we talked a little bit offline, you have to play the liaison to a number of different functions within ACEP and a lot of different initiatives. Take me through a few of those initiatives that you become a key involved figure in.
Well, I've been liaison to several different sections and groups. One of those liaison that is kind of central is I'm liaison to the Emergency Medicine Residents Association, otherwise known as EMRA. And EMRA is just a fantastic group. This is our future. The residents are our future. And there's a lot of issues that, we've kind of brought to bear. One of the things that they have is, the world is changing very quickly right now. As Dr. Kaplan, our president, has spoken during his message, the future is coming faster than we expected. And, it's imperative that the residents stay involved in the organization because really as change happens, it's going to affect them more than it will affect a lot of us older physicians that have been practicing for a while.
So a call to action, if you will. There's a sense of, let's get on the ball now.
Absolutely. Whether you're a resident or a young physician, I'm also liaison to the young physician section as well. We try to bring information to the residents and the young physicians about the changes that are on the horizons so they can be part of directing the college and directing healthcare in general, the direction that is best for patients.
Do you see most of those changes in the health policy sector or in practice guidelines, or where do you see a lot of the changes coming?
They're coming in every direction right now. There's community paramedicine, integrated healthcare, telemedicine's changing things. There's freestanding emergency departments. There's joint ventures. There's so many different things that are happening now, and there's so much consolidation within the healthcare field. We don't even know what's going to be there next year. That's why it's so important to stay involved, whether it's as an EMRA member or when you get back into practice as a young physician section member.
Right. Everybody talks about social media, of course. It's out there. Younger physicians are by and large more attuned to it. Is that an area that you've seen in this liaison role, one that needs special attention to for the young physicians, or is that one that they're actually bringing to the table and trying to inform the older populations in the medical circuit?
Well, social media is an interesting thing that is somewhat controversial even within emergency medicine. But, this is the young physicians, they learn differently. They learn by video. They learn by their smartphones. They learn in small segments. We started off, sitting in 1 and 2 hour lectures. Now things are learned on YouTube in 3 or 4 minutes. And so we've compacted and kind of repackaged our teaching. And I think that's one good example of where the college is going so that we can meet the needs of all of our members.
Right. I think YouTube, that mentioned, for instance, is a particularly apt one. I think a number of our viewers, listeners, even myself, could attest that YouTube might account for maybe 50% of some of the medical education that we receive. It's amazing how many options are out there now for physicians to enhance their practice, to enhance their training and their education.
Absolutely. The more times you kind of see something, it's so much better than looking at it in a book, is to watch a procedure in action. It's active learning. When you hit all the senses, including visual, auditory, all of those things, it just makes a much more effective experience.
If you're just tuning in, this is ReachMD. I'm Dr. Matt Birnholz, and I'm joined by Dr. Paul Kivela. He's Vice President of ACEP, and we're talking about a lot of the new initiatives and mandates coming in for the younger populations, and we'll actually turn to some other populations. Why don't we talk a little bit about the work that you do in regards to annals of emergency medicine? I know that you have a strong role in that as well as a liaison.
Well, I like to take credit for everything, but honestly, there's not much I can take credit for. But I can talk about annals, and it's now the number one, it's been actually for a few years, it's been the number one basically research-oriented publication in emergency medicine. And even over last year, these publications are graded by what's called an impact score. An impact score looks at how often those articles in that publication have been sourced by another publication. And so Annals is number one in the emergency medicine space, and even over the last year, its impact score increased by 8%. Some of the things that I think members don't know is that traditionally Annals was thought as a publication just for academics. but there's a tremendous number of articles in there that have total clinical relevance. And we tried to make that much more clinical. There's also some sections in there just talking about advances and changes in medicine. And along the same lines, there's podcasts for our members to listen to on the way to work, and that are very, very meaningful at reviewing the articles. So it really there's a lot of ways to get that information out of there rather than sitting down for hours reading a, quote, academic journal, as I know a lot of clinicians really don't do anymore.
Right. Were the multimedia editions, were those recent?
Yeah, those have been relatively recent, but there's also tweets that go on from Annals. So there's a lot of ways to stay in touch with what Annals is publishing.
It's an interesting role that you have in that liaison role. You sort of get to have a bit of oversight, you get to be a correspondent, consultant in respects. Where do you see a journal like Annals heading from here?
Well, I think like I said, I think it's, traditionally it's getting more and more clinical, and I think there's going to be more and more articles on healthcare policy as things change. Annals, the staff and the physicians involved are fantastic. They really have a good grip on where medicine's going, and they engage a lot of different sources. So I think it's a publication that I hope everybody continues to read.
And do you feel like that direction, that shift that's taking place in front of you with Annals and with others that you're a part of, do you think that's reflective of a shift in sentiment towards emergency medicine in general, or from emergency medicine? Because the history of emergency medicine was often staked in a feeling of exclusion, of not being seen as a recognized specialty compared to the 63 others, and that led to part of the logo for ACEP, which is the one excluded square. Clearly that's seen a shift. Emergency medicine is in the limelight, perhaps more than many other specialties now. But do you see that play out in practice or in such journals as Annals or other types of media that's around ACEP?
Well, when the impact score goes up, everybody takes notice. So now we have even emergency physicians from other countries trying very diligently to get published in Annals. So when the impact score goes up, it gains a lot of attention. And since we're the number one publication in the emergency medicine sector, certainly, they have so many great articles that they can't publish all of them. So I think what it does is it makes it very competitive. But, it's not just academic articles. It's policy articles I mentioned. There's also editorials and viewpoints and even updates on different things that are kind of coming down the pipeline. So I think there's a lot of things that are very, very interesting in that journal. And I hope if you haven't looked at an issue in a while, that this encourages you to go out there, open up an issue or two, and really see what's getting covered in Annals.
Right, and I would reflect that out to our audience as well. I think that's a good incentive, a good call to action for them to check it out and see how things have changed and perhaps improve that impact score.
Yeah, hopefully it'll be up another 8 or 10% next year.
Well, let me broaden it up before we wrap up. Anything on the horizon for ACEP in general? Obviously, you're in a unique position as vice president. Anything that you want to impart to our audience about where ACEP's going or where you intend to be?
Well, I think one of the things that's happening is change is happening very quickly. We're trying to stay on top of all the different changes and make sure that we direct them so they're in the best interests of the patients and the physicians, and that those are collaborative issues. Some of the things just briefly on the horizon, we're looking at data repositories so that we can make sure that we capture and control the right quality improvement measures. There's also things that we're looking at coordinating care. We are also working on a data repository that will push information to the physician. So when a patient walks in, you already know whether the prescription drug monitoring program has lit up on their name, or whether they have a post form on staff, or how many CT and other radiologic imaging studies they've had performed. That would make our doctors and our physicians and make my practice a lot better and a lot easier. And it would also, in the best aspect of it, improve patient care. And that's what we're really here to do, is we're here to better serve our patients.
Expertly put. You should take my job. It's perfectly articulately put. With that, I do want to thank Dr. Paul Kivela for joining us. We've been talking about ACEP's present and future, the horizons. And I'm Dr. Matt Birnholz for ReachMD. Dr. Kivela, thanks again for your time.
Thanks, Matt.
For more access to this and other podcast videos on ReachMD, come over to reachmd.com, and thanks again for joining us.